Today, the White House hosted a panel on the urgency of funding for opioid and heroin abuse. The Director of National Drug Control Policy urged Congress to provide $1.1 billion in treatment funding. Meanwhile, in Arizona, there are new tools to help several counties fight the opioid epidemic in our state. Dana Lewandowski looked into how grant money from the Centers for Disease Control and Prevention is being spent.
The Arizona Department of Health Services chose Yavapai, Pima, Mojave, Maricopa, Gila, and Navajo counties to split the $3.6 million in grant money. The grant money will be going to 3 areas: hiring more people to oversee the progress with Arizona's fight against opioid addiction, maintaining the prescription drug monitoring programs, and implementing the Community Action Toolkit. Tommy St. Mars, chief of the Office of Injury Prevention at AZDHS, said, quote, "It's taking the 5 identified strategies and implementing them at the county level, with the emphasis upon ensuring that their pharmacists and prescribers are registered within the prescription drug monitoring programs," end quote. As part of the national fight, the Drug Enforcement Administration has reduced the amount of opioids manufacturers can produce next year. One pharmacist did say that there's a downside to the tighter controls on these narcotics, especially because it forces them to make tough decisions.
We are being limited in our supply, so we have to decide who's going to be able to get their prescriptions filled.
In Phoenix,